Moving on from obesity to correlates, and having diabetes and having high blood pressure, everybody expects that you're going to get them, you're going to go and have them managed, and you're going to try to deal with all the complications. Well, how about prevention? We actually have good data that vegetarian diets, and that is, there are a variety of vegetarian diets. People who are half vegetarian, people who are vegetarian but they still eat fish. Then there's the ovo-lacto, and a fair number of those, because I'm showing you Adventist health studies, and the Adventists actually do, were telling people for decades to do eggs and milk. Now they're changing their tune after they saw all of their 30-year outcomes, that the vegans, people who ate no animal products, were doing so much better. They were the only group that on average was not overweight, body mass index, again, greater than 25. They were the lowest amount of diabetes, the lowest amount of hypertension. And there was a big impact on death rate, about a 30% decrease. That's a hazard ratio of 0.7 for dying of heart disease of any kind. And if you looked at what happened over time, it seemed like their older people were getting more and more vegan, and the people who were not vegan were not around much anymore. And so that really is a very telling curve. Bottom line of their studies is that if you do a vegetarian diet, you're going to live almost a decade longer. You're going to be 30 pounds lighter, less disease, more life in your life. And so this is an opportunity for everyone to change to a diet that's going to not just enhance their, their weight and disease states, but actually feel better about themselves. Let's talk specifically about blood pressure, because almost everyone's blood pressure, if you don't have some specific disease that's causing it, so-called secondary hypertension, if you don't have a disease that's causing it, it's pretty much your diet. And people are eating too much sodium, and they're eating too much saturated fat, and they're overweight. And when you do a dietary intervention, like a vegan diet, you can get some massive decreases in blood pressure. And so this is the famous DASH trial. And you could just see starting off blood pressure in the 130s, ending up in the low 120s. When you do a diet that's low in fat and cholesterol, that would be much more of a vegetarian diet. So our 2017 American College of Cardiology guidelines were published, and we were the ones who changed the definition of high blood pressure from 140 to 130. And of course, we were accused of being in the pocket of the drug companies. That just meant that they didn't read the document, because this is what we were pushing. Non-pharmacologic. That means no drugs unless you absolutely need them. And what we're talking about is things that people should be doing all the time. So at least 150 minutes of exercise. And if you add these together, I'm telling all my patients to do 300 minutes. Aerobic exercise, dynamic resistance, that's like doing weights and isometric resistance like Pilates and planks and that sort of thing. Each one of them has a drop in blood pressure of 5 millimeters or 4 millimeters. Cutting back on the alcohol, that also lowers the blood pressure. Losing weight. Everyone should please remember your sodium on a daily basis should be no more than 1,500 milligrams. And if you're and get the potassium as high as possible. That's actually very easy to do these two if you're doing this. And that is a heart healthy diet. It's rich in fruits and vegetables and whole grains. That in and of itself will get you 11 millimeters off your blood pressure. So if you add up all of those things, you can get 20, 30, 40 millimeters of mercury off your blood pressure. Who needs medication if you do the right thing with your lifestyle? I'm going to talk about diabetes for a moment. People don't realize that refined grains like white bread are treated like by the body just like sugar, of any variety of sugar, including fruit sugar. The fruit sugar is healthy if it's in the fruit. If you take it out and you make like high fructose corn syrup, which you'll see in everything, including barbecue sauce and and even ketchup. When you take that in, you get a spike in blood sugar, but you also get a spike in insulin. And insulin is not our friend in cardiology. It creates badness in the cholesterol and badness in the blood pressure, and it creates diabetes, all of which make plaque, or so-called atherosclerosis. Those plaques are the bane of our existence. It's what we spend all of our time trying to open up, get rid of the plaque, squeezing it, bypassing it, If we could change the underlying causes, we could have much better outcomes and so much fewer heart attacks, stroke, peripheral artery disease, erectile dysfunction, aortic aneurysms, which people think, wait a minute, that's where your aorta gets enlarged. That is still a manifestation of atherosclerosis. It weakens the wall, and then the high blood pressure balloons out the thing, and people die of aneurysms. It's all really the same disease, just one form will narrow it. You get a narrowing in one place and an enlargement in another place. It's still the same disease. So don't sugarcoat it. Eating sugar will actually mess up your cholesterol, give you diabetes, particularly if you're not doing the exercise well, and it increases inflammation. Now, many of you have actually heard about cholesterol causing heart disease. Most people have. Then not as many people have heard the data from Harvard, from Paul Ricker, that inflammation causes heart disease just as much as cholesterol does. And so you'll see, now most people actually have heard this. You hear that, I got the flu and it gave me a heart attack. Flu shots decrease heart attacks in a community by 60%. That you get a dental abscess and you end up with a heart attack. Those are all examples of inflammation. And COVID-19 does the same thing. The more inflammation you have, the higher your heart attack risk. Well, just drinking a sugary drink increases your inflammation markers, such as C-reactive protein. So it's something that we really don't need to add to our bodies. And this is the data. You know what your hazard ratio is. You know it should be 1.0. And when you get about 12, 13% of your diet being sugar, then you start to see the increase in death rate. And the more sugar you do, the more you die. So let's back off of it. We actually had this data for a long time in our nurses' health study. They said, okay, what's making 30 years of outcomes of nurses' health study? What makes nurses die? Number one was getting older. Yeah, we probably could have figured that one out. But number two was actually diabetes. Number three was smoking. But in the upper right-hand corner here, there was dietary stuff. You eat fiber, your risk of dying goes down by 16%. You eat a hamburger, cholesterol goes up by 17%. But people kind of ignored this for the longest time, that a sugary drink, or a donut increased your death rate more than eating a cholesterol item, such as a hamburger or a steak. And so something that was buried in the literature, and then it started to become much more recognized as more data sets started looking at long-term consumption of sugar-sweetened beverages, increasing death rate. The numbers get really bad. They're worse for actual sugar than they are for artificial sweeteners, but artificial sweeteners do the same thing. So it's not quite as bad. Here's another hazard ratio for you. Please don't be a high consumer of artificially sweetened beverages, because you can get some very high increase in risk of dying. When you look at diabetes, though, and so many of our patients are diabetic, is there anything that we can do about it? Well, first of all, you can prevent it by doing plant-based nutrition. And there's a good curve here that shows that hazard ratio going down, 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 the more plant-based you are. So it's very simple. It's exactly what the US government was trying to tell people: eat more fruits and vegetables, and you will see a lower rate of these risk factors, including diabetes. Okay, so once you are diabetic, does it make any sense to change your diet? You bet. Every diabetic in the group listening today knows that you're supposed to be following your hemoglobin A1C, and your hemoglobin A1C will fall with a vegetarian diet. The one that didn't work so well was the lacto-vegetarian, because the milk is actually not good for you, but the low-fat vegan diet consistently lowers the hemoglobin A1C. I threw this one in there because not everybody recognizes that sick people feel sick. It sounds like silly, but it's actually very true. And the sense of well-being is actually lowered when you're sick. And so a plant-based diet actually does, if you do an intervention in a diabetic, you get an improvement of the emotional well-being, not just the physical, less depression, better quality of life, better overall health, as well as the stuff that you would imagine, hemoglobin A1C, weight, cholesterol, and overall risk. So bottom line is, diabetes is associated with the things that we eat, particularly refined carbohydrates, but also red meat. And if we avoid the saturated fat, for example, from animals that increases both cholesterol and increases weight so efficiently, we can actually lower our diabetes rate. Everybody should be a thin, walking, everyday vegetarian, and this diabetes issue would go away. Okay, going to talk a little bit about fat because this is highly controversial. You see it all the time. People say that saturated fat is actually good for you. Nothing could be further from the truth, except trans fats, which are now illegal in 4 countries. So I don't have to talk about it much anymore because the United States is now one of them. But monounsaturated fat and polyunsaturated fats, mostly from vegetable sources, actually do decrease the death rate, hazard ratio of 0.73. That's a 27% reduction if people would just be conscious of what kind of fat they're going to eat. Now, there are plenty of vegan people who are saying you shouldn't eat any fat at all. The fat you eat is the fat you wear. That's actually true. And so, but we're talking about in terms of your cholesterol and in terms of overall mortality, the data, if you're going to eat fat, it should not be saturated fat, which means lessening the animals. This one came out, the Pure trial a few years ago, and shocked the world, saying that eating fat was actually better for you than carbohydrates. They finally did correct it. They're friends of mine. I said, guys, you buried it in the methods. The problem was carbohydrates, that is starches, breads. If you're doing them with whole grains, it's good. And if you're doing them with refined grains, that white bread, the pretzels, the bagels, then they turn right into sugar and generate the insulin, as we said a few slides ago. And so, yeah, they were talking about replacing carbohydrates with fats was going to lower the death rate. Yeah, that's because refined grains are actually poisonous, essentially. And so, yes, dietary fats are better if you're going to have, if your body can tolerate it. Yes, eating more healthy fats, olive oil and the like, is going to be better than saturated fats. Okay, I'm going to switch over and talk about cholesterol and inflammation. And this is another sad realization. This was a little later, so this is like 4 or 5 months into the pandemic, when we realized that high cholesterol actually was helping the COVID-19 virus get into the cells. It actually uses cholesterol to get into the cells. So if a person is running around with a high cholesterol level and they get COVID, they're going to get more serious infection, because instead of just running around the bloodstream harmlessly, it's actually going to go into cells, particularly fat cells, where they can reproduce. Does cholesterol get affected by what you eat? Absolutely. The more animal products you eat, you're getting a massive amount of cholesterol. And there's essentially zero cholesterol in any plant-based foods. And egg whites are actually pretty good in terms of being low cholesterol. Great. Only problem is people are eating egg whites with egg yolks, and it's a massive amount of cholesterol. The only thing that's worse than egg yolks is brains. And I know a lot of people whose families are from the South, they actually ate brains, hoping that everyone is tamping down on that. Can you intervene on your cholesterol and your inflammation with diet? Absolutely. And this is one of the first studies in the Journal of American Medical Association, 2003, showing that if you did an intervention with a plant-based diet and with fiber and soy protein and nuts, in this case almonds, that you would see a dramatic fall in LDL cholesterol. And if you took a statin, you'd also see a dramatic fall. And when you compare the results between the statin and the vegan diet, they were almost identical. The C-reactive protein went down, the LDL cholesterol went down. And so this would lower people's risk tremendously. That anti-inflammatory stuff has actually been reproduced, published just a couple of years ago, showing that the American Heart Association, very proud of the American Heart Association to publish a study saying that their diet was terrible, but they knew that they should move on, because they did work with us on the guidelines. But a vegan diet lowers your inflammation as well as your cholesterol and your weight and your blood pressure and your blood sugar, where you don't get that kind of effect with the American Heart Association diet, because it has animal products, less red meat, more fish, more chicken, still not helping, and not as much as it could be.